Hi, my name is Bailey Colindres, and I am a Doctor of Physical Therapy student at Regis University. I am very passionate about the neurologic population and inpatient rehab. My passion for rehab was ignited during my time working at the Children's Hospital in Portland. I was on the inpatient rehab team, and there I saw firsthand the impact that skilled physical therapy had on patients and their recovery, independence, and quality of life. This experience solidified my desire to pursue rehab-focused physical therapy and individuals with spinal cord injury, traumatic brain injury, and other complex neurological conditions. This is why I'm very excited about the opportunity for a clinical experience at Craig Hospital. Craig's reputation for excellence in rehab is its interdisciplinary approach and its commitment to maximizing patient-centered care strongly aligned with my professional goals as a physical therapist. My experience in rehab has taught me that flexibility is essential, particularly when working with medically complex patients whose needs can change daily. While working on the rehab team, I learned how patient tolerance, cognition, fatigue, and medical status often require adjustments to my planned interventions. I approach this flexibility by staying prepared, prioritizing my patient's safety, and communicating clearly with my CI and the interdisciplinary team. When plans change, I want to reassess goals, modify interventions, and focus on what will be most meaningful and functional for the patient that day. I view adaptability as a strength, and that allows me to grow clinically while managing high-quality patient-centered care. One of my greatest strengths is my ability to build meaningful connections and relationships with my patients and families while remaining professional, accountable, and team-oriented. During my time as a rehab tech at the Children's Hospital, I worked closely with pediatric patients recovering from various traumas. One kiddo in particular has stuck with me. He had been with us for a while and struggled significantly with therapy due to the severity of his TBI. Over time, he started to engage in therapy more consistently when I was present and would often request that I assist with therapies. Upon discharge, his family wrote me a heartfelt letter thanking me for the impact that I had on his recovery and for the relationship that we built during a very challenging time for him. That experience, along with others like it, continues to remind me of the impact that we as physical therapists can not only have on patients through clinical skills, but also through compassion, consistency, and genuine connection with them. And I now carry that mindset with me into every clinical environment. I actively seek constructive feedback and view it as essential to my development as a clinician. Throughout my academic and clinical experiences, I've learned that I receive feedback best when it's valuable and it's received openly and applied intentionally on my part. I focus on listening without defensiveness, asking clarifying questions, and implementing changes, whether that's refining my handling skills, improving efficiency, or strengthening clinical reason. I also believe in clear communication with my CI and plan to discuss my learning preferences early on. I appreciate regular feedback from my CI through brief daily inputs or scheduled check-ins. I believe this creates a strong learning environment and ultimately improves patients' care. In preparation for my clinical experience at Craig, I plan to review spinal cord injury, traumatic brain injury management, outcome measures commonly used in inpatient rehab, and evidence-based interventions for neurological populations. I also intend to familiarize myself with Craig's mission, care model, and interdisciplinary approach so that I can integrate seamlessly into the team. Drawing from my prior rehab experience, I understand the value of showing up prepared, having initiative and accountability, and I am committed to arriving ready and eager to learn and contribute from day one. After graduation, my goal is to work in a setting where I can continue to grow as a clinician while providing high-quality, patient-centered care. Ideally, this would be within a neurologic population or a rehab setting. Long-term, I want to become a physical therapist who is trusted by patients, valued by colleagues, and committed to a lifelong learning. I want to contribute to the rehab environment like Craig Hospital that prioritizes excellence, collaboration, and meaningful patient outcomes. Again, my name is Bailey. Thank you so much for the consideration.